psychosocial risks. Enforcement of the Working Time Directive should be mentioned as well. We appreciate that the report recognizes the role of digital tools and innovation in easing the workload and improving access to care. But, colleagues, digitalization and artificial intelligence are not silver bullets. They can't replace the human connection or the need for enough well-trained, well-supported staff. Digitalization is there to complement, not to replace. Safe staffing levels must be at the heart of any European healthcare strategy. We need joint planning across member states to make sure we have the right people in the right places and that healthcare workers are treated with fairness, with respect and with dignity. We are glad the report touches on mental health because this is an urgent issue. The latest World Health Organization survey shows 1 in 3 nurses struggles with mental health problems. Protecting our staff from burnout, stress, and even violence is vital for both their well-being and for patient safety. We should also invest much more in primary and preventative care. This is where we can really make our systems more resilient and fair. More doctors, nurses, and pharmacists is good for us, but less patients is even better. On public-private partnerships, we have to be careful. When healthcare becomes too commercial, we often see worse outcomes and lower patient safety. Public interest has to come first, and we know from experience that public-private partnerships do not prioritize public interest. And finally, colleagues, Chair, I'd like to underline that health is not a defense issue as framed in the report. However, healthcare sector is a key component of the comprehensive security agenda, which adopts the whole of society approach. We will be making amendments along these lines. And finally, I would like to remind that the previous EU-level commitments and plans from 12 to 15 years ago have not created an optimistic situation for us today. Instead, it seems like things are going from bad to worse. Therefore, I believe we must increase our ambition and put all our shared efforts into this issue if we want sustainable healthcare systems that truly put patients and professionals at the centre. I'm looking forward to the negotiations with all my colleagues and trust we can create a powerful message on the future of our healthcare sector.
Σας ευχαριστούμε πολύ. Από την πολιτική ομάδα της Αριστεράς, η κυρία Kathleen Fansion.
Thanks very much, chairs, I should say. So first of all, I want to thank the two rapporteurs for their work on this draft report and look forward to engaging constructively with everybody in relation to working towards a good, strong text fit to meet the challenges that we know we all face in our individual countries. First off, I do think as well it's important to acknowledge that health is a competence of our individual member states. Reports like this are really great and good and useful tools for the exchanging of best practices and ideas, but I believe we should endeavour to ensure that decisions that impact our communities are made as closely to our communities as possible and in collaboration with them and other stakeholders such as social partners in our individual member states. So one area where we believe the draft report can be improved is in the area of fiscal rules and its impact on the delivery of health services in our communities. Therefore, we will be submitting an amendment in relation to that, calling for healthcare spending to be exempt from the EU fiscal rules. It's important too that we recognise the unique challenges faced in some of our more rural communities and our island communities, particularly in access and delivery of healthcare. This is absolutely something we need to acknowledge and an area where the exchange of best practice can be mutually beneficial to us all and where I think we really can learn from each other. I welcome the acknowledgement of the mental health aspect in relation to our healthcare workers. We all know that working in healthcare can be extremely stressful. It's very intense. And there's huge emotion attached to the job and must be recognised. I'm happy to see it in the draft report. And we know that there is huge burnout of staff due to this in our healthcare sector. An area where I must object, however, and I was really delighted to hear the previous speaker mention this, is the unnecessary inclusion, recital L, which, and I quote, whereas the Ninetza report acknowledges health as a defence issue. We do not acknowledge health as a defence issue. I have can't understand at all why that would be in the report, and I think we should not be including this in a health report. I feel very strongly about that. We see across the EU there's a fight for resources. We see some funding for social programmes, our agricultural programmes. They're being siphoned off to, put these funds potentially into military and defence. It's something we feel very strongly against. I think we need to be very strong that this shouldn't be the case, particularly in healthcare. Healthcare spending shouldn't be threatened with cutbacks just to be funded more towards military and defence. And I really hope we can work towards a wording that's more acceptable to everyone. I really feel that that should not be in a healthcare report. So I will leave it at that, Chair. Thank you.
Θέλω να ευχαριστήσω όλους τους συναδέλφους για τις τοποθετήσεις τους. Τώρα θα περάσουμε στη διαδικασία του Catch the Eye, όπου συνάδελφοι και από τις δύο επιτροπές για 1 λεπτό μπορούν να κάνουν τις τοποθετήσεις τους και τους καλώ να κάνουν το αίτημα αν θέλουν να μιλήσουν τώρα. Θα ξεκινήσουμε από την ομάδα των Patriots με την κυρία Ντελαπή Σακαριών.
Gracias, presidente. Señorías, cuidar a los que cuidan. Esta debería ser la dirección de nuestras políticas. Sin embargo, nos faltan médicos, enfermeras y profesionales del cuidado. Esto es así porque nuestros sanitarios están siendo llevados al límite. Se abusa de su vocación y de su entrega. Se estira hasta el agotamiento una generosidad que no se corresponde con las condiciones laborales. Sufren sobrecarga asistencial, sueldos bajos y contratos precarios que no les permiten crecer ni descansar. Y lo más grave es que esta precariedad muchas veces viene de las propias instituciones públicas. Los colegios de médicos nos lo han dicho claro. Falta protección, faltan medios y muchos viven frustrados porque no pueden atender a sus pacientes como quisieran y se les trata de obligar a prácticas que no siempre comparten, sin respetar su libertad de conciencia y ciencia. Hace falta devolver dignidad a esta profesión y prestigio al acto de cuidar. Si seguimos dependiendo solo del sacrificio personal para cubrir los fallos de gestión, el sistema acabará por colapsar. Si fallamos a nuestros profesionales y sistemas sanitarios, estamos fallando a nuestra sociedad. Cuidar a quienes cuidan no es un lema, es una urgencia si queremos garantizar la salud de todos. Gracias.
Σας ευχαριστούμε πολύ. Από την ομάδα του ECR, ο κύριος Τσοτσιόλη.
Grazie. Il problema più importante in questo momento della sanità è il problema del reclutamento degli operatori. Sono stati fatti nei vari paesi gravissimi errori di programmazione, pensando di programmare tutto. Quindi bisogna puntare al reclutamento a maglie larghe. Il cosiddetto numero chiuso ha provocato dei danni a valle tali che alcune strutture sanitarie non hanno spazio. L'altro problema è la fuga dei medici. In Italia 10.600 medici sono andati a lavorare fuori Europa, in particolare nel penisola arabica, Dubai, Stati Uniti e via di seguito. È un problema remunerativo perché se il servizio pubblico paga poco abbiamo difficoltà nel reclutamento. Ultimo punto, utilizzare l'intelligenza artificiale come metodo di supporto. Nei referti radiografici è di grande supporto, ma anche nelle diagnosi. Occorre andare in questa direzione. Poi c'è il problema della salute mentale, che oggi è soprattutto orientato verso i cosiddetti pazienti gravi, mentre dobbiamo pensare al benessere globale.
Σας ευχαριστούμε πολύ και κλείνοντας από τους μη εγγεγραμμένους με τον κύριο Οντρέι.
Thank you, Chairman. I would like to remind of some problems which are small but burdensome for the medical doctors and nurses. We should start small with applying the already existing rules. First of them, administrative burden of postgraduate education of doctors is unnecessary in some cases, and it stems both from wrong interpretation of EU laws and also from somewhat Byzantine conditions in some teaching hospitals hospitals in my country. This is one of the big drivers of exit of doctors to other countries to search proper postgraduate education. This is something the Commission should take a look at because this is its role. Second thing is elimination of unnecessary burden from wrong understanding of EU laws like the GDPR. Healthcare workers in my country generally hate GDPR because they see it as something which added paperwork and blocked them from sharing the patient data with the colleagues who treat the same patient. But this was never the purpose of GDPR. It is just wrong interpretation, but quite widespread in the country. So it is necessary to provide correct interpretation so the doctors, especially young doctors and nurses, are not burdened by something which actually is not in the EU law. And finally, it would be good to take a look at continuity of cross-border care, to take a look on accepting qualifications and competencies from medical doctors and nurses who are from the other side of the border, for instance, in areas like emergency care. So this is the third thing I would like to recommend to take a look at. Thank you very much.
Σας ευχαριστούμε πολύ. Θα περάσουμε τώρα στους εκπροσώπους της Ευρωπαϊκής Επιτροπής, ξεκινώντας από τον κύριο Νικόλαο Μιτσουρίδη από την Επιτροπή Απασχόλησης.
Yes, thank you very much. Working conditions that respect the health, safety and dignity of workers are a fundamental right and are also a precondition for having well-functioning and resilient healthcare systems. Good occupational safety and health increases productivity, helps include and retain more workers, more people into the workforce, prevents absenteeism, prevents operations breakdowns, makes the sector a more attractive employer. Commission services are regularly assessing ways for improving the EU acquis in the area, including its implementation application, to fully put into effect the basic principle that the health and safety of workers must be ensured in every aspect related to their work. Examples of such work that are particularly relevant for the healthcare workforce are, for example, the Commission's guidance on the safe management of hazardous medicinal products and the indicative list of hazardous medicinal products, the Senior Labour Inspectors Committee's guides for labour inspectors on the Biological Agents Directive, EU OSHA's research project Health and Social Care and Occupational Safety and Health. Under this project, research areas will include, among others, musculoskeletal health, mental health and digitalization, and various practical tools and guides developed by EU OSHA to help with the application in practice of the rules. For that, we have tools, for example, on managing stress and psychosocial risks, managing dangerous substances and musculoskeletal disorders, including 20 online interactive risk assessment tools that are relevant for human health and social work activities. On professional qualifications, the Professional Qualifications Directive establishes a well-functioning system, ensuring that professionals can work across the EU. 6 of the biggest healthcare professions are covered under the system of automatic recognition. These include general practitioners, specialist doctors, and nurses responsible for general care. Despite this, citizens occasionally face cumbersome and lengthy procedures. The Commission is fully committed to taking action to further facilitate recognition processes, in particular by leveraging digital tools in the context of a skills portability initiative announced in the Union of Skills. By the end of the year, the Commission will adopt the Quality Jobs Roadmap. It will focus on very relevant areas such as working conditions, fair wages, workers' health and safety, including mental health, and enablers for quality jobs such as social dialogue. In 2026, the Commission will propose a Quality Jobs Act. On social dialogue, the Commission facilitates social dialogue through 44 sectoral social dialogue committees, one of which is on hospitals. Thank you very much.
Σας ευχαριστούμε πολύ. Και τώρα από την Επιτροπή Υγείας, η κυρία Πτάκ Μπάφκενς.
Members of the European Parliament, thank you for giving me the opportunity to speak. I would like to acknowledge our continued engagement and efforts to bring attention to the crucial challenge of strengthening the health workforce. Health professionals, from doctors and nurses to carers, are the backbone of our health systems, sustaining our societies, even under very difficult conditions, as seen, for example, during the COVID pandemic. I acknowledge our commitment to supporting, retaining, and training a resilient workforce. Ongoing EU initiatives, for example, the Joint Action on Workforce Planning, but also our nursing initiatives, several initiatives on skills, reflect this priority. Now, we must first consolidate and assess current EU actions to identify what works, what is effective, and has a lasting impact. Collaboration with member state stakeholders and partners remains essential for us. The European semester and the EU Health Union also support these efforts. Together, we strive to ensure resilient, sustainable health systems across the Union. Thank you very much.
Σας ευχαριστώ. Θα επιστρέψουμε τώρα από τους συνεισηγητές, στους συνεισηγητές να κάνουν μια τελική τοποθέτηση. Δεν ξέρω αν το Λαϊκό Κόμμα δεν βλέπω κάποιον, οπότε θα περάσουμε αμέσως στον κύριο Ράτσα εκ μέρους του ECR. Δεν υπάρχει κάποια σύνδεση, οπότε θα ήθελα να σας ενημερώσω ότι εδώ θα ήθελα να ευχαριστήσω όλα τα μέλη της Επιτροπής και Υγείας και Απασχόλησης για τη συμμετοχή τους σε αυτή τη συζήτηση. Θα ήθελα να ευχαριστήσω φυσικά και την Επιτροπή για την πολύτιμη συμβολή και την ενεργό συμμετοχή της και προσβλέπω στη συνέχιση του έργου μας σε αυτή την πολύ σημαντική έκθεση.
And also, I would like to thank everyone for active participation, also to the Commission, and good luck to the rapporteurs and shadows for the next steps and the work on this file. As was mentioned, the deadline for tabling of amendments on the draft report is 4th of November at 12. So, dear colleagues, I close today's meeting, and our next joint meeting will take place on the 24th of February next year. Thank you very much.